Hi and welcome to the channel. I'm the Grumpy Old Hermit. Today I'm going to talk about something very different from my normal topics. Today I would like to discuss this magnificent beast you see behind me. This is Boomer, or as my grandkids call him, Boom Boom. I've had him since he was around 2 years old. He's a really great dog. He's really laid back. He's friendly to everybody. He's almost 10 years old now. And that brings us to the topic of today's video. Around 4 years ago, Boomer began having seizures. It was a really big change for all of us, and so I thought I'd make a video telling you what I've learned since that time in hopes that if you have a dog that develops epilepsy or starts having seizures, some of what I discuss will help you to understand to be able to help your dog much better. To be honest, every seizure is horrifying to watch, but none so much as the first one. When Boomer had his first seizure, I had never seen a dog have one before. I completely lost my mind when it happened. I thought he might die right there and then, and there did not seem to be anything I could do to stop it. I didn't know if he'd gotten into something or ate something he shouldn't have. And once the seizure was over, it took him for a while to recover. He was obviously confused and afraid of just about everything, including me. When I tried to comfort him, he turned over and snapped at me because I tried to touch him and he didn't want to be touched. And it was a good couple hours until he settled down, at least enough for me to get him to the vet. It took a while and a few different vets before we finally decided on a diagnosis and program to deal with the seizures. It was established that Boomer likely had epilepsy, but it took a couple of years to really confirm that diagnosis. That's because at first the seizures were very sporadic, maybe one every couple months. We didn't even have medication program in place until this year. That's because the first seizures were very sporadic, maybe one every couple months. We did not even have a medication program in place until this year, 2024. So let's discuss how I think I can help your dog if he begins to have seizures, and some of the things I wish I had known that would have helped me with Boomer to help him a lot more than I actually did. So first I guess we should cover what a seizure is and what causes them. I'm no expert by any means, but after the last few years, much reading and countless conversations with vets, this is how I understand them. Many things can cause a seizure in a dog: an allergy, overexcitement, trigger events. An example of a trigger event that I can give is one that I heard from our vet. He had a dog that would have seizures every time he came to the vet's office. As soon as he walked in the door, he would seize. So, what the dog perceives as extreme stress can trigger a seizure as well. But the two most serious types of seizures come mostly from either brain tumors or epilepsy. In Boomer's case, it turns out to be the latter. I'm incredibly thankful that it was not a tumor. So, as for the seizure itself, this is what I've learned so far. A seizure is caused by the brain producing an abnormal electrical signal. This begins in a small part of the brain. The signal will eventually increase until it passes a specific threshold. At that point, the seizure will begin. The seizure itself should only last no more than a couple of minutes. If it lasts 5 minutes or more, you need to get him or her to the vet immediately. My understanding from the vets I have talked to is that the dog is basically unconscious during this time and is not in any real pain. That is understandably hard to believe when you are watching it play out. Once the main seizure is over, there is an after effect that usually lasts for about a couple hours. The dog will likely be very anxious, seem absolutely ravenous when it comes to food, be really standoffish, may pace around a lot, want to go inside and outside. He can't settle down. They will also be rather unstable on their feet. And in Boomer's case, he would go blind for a period of time. Generally, his sight would return within a half hour or so. But once the seizure's done, the next 24 hours is very important. If your dog has a second seizure in that 24-hour period, then that is considered to be a cluster seizure. From Boomer's experience, he can be anywhere from multiple seizures in a day to one seizure every day for multiple days. It can vary quite a bit. But the important milestone is that 24-hour mark, because at that point the brain resets and the process starts over. It can be weeks before he has another seizure. When Boomer first started having seizures, they were probably a couple of months apart. As time went on, they became a bit more frequent. That was up until the beginning of this year, 2024. Since that time, his seizures have become much more frequent. He began having them about every 2 weeks. It wasn't even about every 2 weeks, it was every 2 weeks. It was almost like clockwork. By this time, I was very concerned, if you can imagine. I ended up changing vets. It was the best decision I could have made. I should have made it much earlier. After having Boomer checked out by the new vet, we began on a routine of meds. I should note that the prior vet had said that we could put Boomer on medication if we, quote, wanted to. But that would require Boomer going in once a month, have his blood, liver, and other vitals checked because of the harm from the medicine. To me, it seemed as though the drugs would do more harm than good. Again, I was ignorant. So we put Boomer on a drug commonly called Keppra. These come in 2 kinds. The first is a lower dose, but you need to administer it 3 times a day, 8 hours apart. For me, this was very difficult, because the time must be pretty precise. We then switched to a dose that only required it to be given twice a day. Being precise on a 12-hour day is much simpler. However, Keppra did not seem to work. He was still having seizures every 2 weeks. Now, the idea of these meds is that they raise the threshold so that the electrical signal does not surpass it, and that was when the vet added zonisamide to the regimen. After this, things still were about the same, but the seizures seemed a bit less severe and the black blindness seemed to have gone away, for now at least. So now we're at the point where he only has seizures about every 2.5 to 3 weeks, but he does still have clusters. So to knock those back, when he has a seizure, we started him on Valium for 3 doses over 24 hours to stop the cluster. So far, this has had inconsistent results. The first time they worked great. The second time, he had 2 more seizures while on the Valium. And the only thing worse than having your dog have a seizure is have him have a seizure while he's on Valium, because now after the seizure, he's just like really high and he already has a hard time walking, and now the Valium makes him stagger. Although I've spoken to the vet about this and the vet doesn't seem to be a problem, he thinks that we should keep him on the Valium. And hopefully that'll go ahead and kind of go away over time. But anyway, as of this week, we've increased his dosage of Keppra and are hoping for the best. If the seizures get much worse though, our options become much smaller. The next drug we would have to give him would be phenobarbital. This would change things a lot. First, we would have to monitor closely for liver issues, and the second would basically be he sleeps all the time and not able to do the things he enjoys. He likes going out for walks, he likes hanging out with us, destroy his quality of life, let's say. The one thing I will say here is that I'm telling you this so that you can hopefully avoid the mistakes that I've made. I should have absolutely started Boomer on medication sooner. This is because I found out about a month ago that every time the dog has a seizure, that abnormal electrical signal, well, it has a good chance to spread to another part of the brain. This means that now he has 2 parts of the brain that can cause him to seize, and it gets much worse with every seizure. That makes it much harder for the medicine to control. Another thing I would like to talk about is how to give your dog the pills. We're talking about a lot of medication here. A lot. Boomer currently takes 8 pills every morning and another 8 pills every night. As you can, I'm sure, imagine, no dog wants to take that many pills. So you must find a way to not only get him to take the pills, but also, and this is extremely important, they cannot chew the pills. They must be swallowed. That's because the pills are time release. If they get broken, it does not last the time it needs to. And if it doesn't last the time it needs to, then the dog is more likely to go into seizure. So, how do we get them to swallow the pills whole? The absolute best way I've found to do this is by using deli meats. I'm not talking about the fancy ones that are all folded up in the package. I'm talking about the cheap packages of sliced ham that you can buy pretty much anywhere. The nice thing about this is that they're packed with water and they're really slimy and slippery. So to do this, I give Boomer a plain piece of the ham when I give him his pills. Now my fingers smell like ham and they're all wet with the ham juice. This allows me to give him the zonisamide just by itself. That's because my fingers smell like ham, so he thinks it's ham, and the pills are gelatin, and so they're already all kind of slimy a little bit, and so he just swallows them pretty easily. As for the Keppra, well, that's a little different. So that I'll wrap in a piece of ham just big enough to cover the pill. This makes it so the piece is so small that he'll just swallow it. If you wrap it in a piece that's too big, he'll try to chew. He cannot chew. It's also helpful to put the ham in the center of his mouth and just slightly hold the bottom of his jaw so he swallows. This works out so well that Boomer actually lets me know when it's time for his meds. He loves ham, and then he always gets some cheese afterwards, and his favorite food is cheese. So, yeah, he lets me know when it's time for meds. One last thing I will say is that having a dog that has seizures is hard. They don't come at convenient times. You must keep a close eye on them all the time, but especially after a seizure. But always keep in mind your dog's perspective. They have no idea what's happening to them, and there's no way to explain it to them. The most important thing that you can do is just be with them, reassure them, comfort them. Remember, when our dogs came to live with us, we made a contract with them. We would make them a full pack member and help them live their best life. And in return, they promised not to judge us for the idiotic things we do as humans. We 100% get the best of that deal. Anyway, that's all I have. I hope that if your dog has just started having seizures, this video will be of some help to you. If you have any questions or something to add to what I've said, because I certainly don't know everything about this, please leave a comment. Thank you so much for watching.